Hi, I'm Megan Farmer for the UAB Department of Genetics. Come with me while I talk to a patient about genetic testing and how it might be important for a patient's cancer treatment, prevention, early detection, or risk reduction. Then we'll talk about how this could be important not only for that patient, but their family members, and ultimately how we can work together with other doctors in the healthcare system. Good morning, Ashley. How are you?
I'm good. How are you?
I'm doing well. My name is Megan Farmer. I'm a genetic counselor. What have you been told so far about what to expect today or why you're sent to see us?
Well, we've just learned that my father's been diagnosed with colon cancer, and I'm worried that I'm at risk too. So I spoke with my doctor, and she recommended that I come see you.
Okay. How's your dad doing?
He's doing okay.
Good. I'm sure he's worried about you too. That's how most dads are. And in genetics, we do think about the whole family. So I thought it would be helpful to go over your medical history and the family history, see if there are any red flags that make us wonder if there could have been a genetic reason for his cancer and some of the cancers in the family. We can talk about genetic testing and whether it's appropriate in your family's case, who the best person in the family is to test, and then how that could impact you and really the family as a whole, and kind of come up with a good plan together.
Okay, so what is genetic testing and how is it done?
Genetic testing is usually a blood or saliva test that's done in office, and then the genetic counselor would call the person back and talk about test results and come up with a plan, and then that plan would be sent over to the doctor's office as well, so that all of us are sort of on the same page, and a customized plan could be made for the whole family at that point.
So do I need to be tested?
We'll have to look at the family history in more detail. Based on the information I have now, your dad might actually be the better person to test since he's the one that's had colon cancer. And I think when we go through sort of the genetic background, that might be a little bit more clear. But certainly by the end of the session, we'll have a plan.
Okay.
Okay. So I understand you've never had cancer yourself.
No.
Pretty healthy, no surgeries or anything like that. And as far as family history goes, you said your dad was just recently diagnosed.
Yes.
How old is he?
50.
50. So pretty young to have colon cancer. And I understand his sister was diagnosed with uterine cancer when she was 45, and her son actually had stomach cancer, and that your dad's father had colon cancer as well. So this might be something that was sort of on the family's radar anyway, and with your dad's recent diagnosis might have kind of gotten everyone talking again. Mm-hmm. Okay. So when we look at these family histories, there's certain red flags that we look for when we wonder if there could be a genetic reason for cancers. Things like cancer at early ages. And for colon cancer, before the age of 50 or around 50 can be suspicious. We're also more suspicious if we see multiple cases of cancer on the same side of the family that are the same type. And we see colon cancer in both your dad and his father. We're also more suspicious if we see cancers that we know can be related, clustering on the same side of the family. And we know colon cancer, uterine cancer, and other GI-type cancers can be related in a condition called Lynch syndrome. With that condition, we can also see some other cancers like ovarian cancer, which we don't see in your family, but it doesn't necessarily rule it out, and you actually don't have a lot of women on your dad's side of the family, so that's something we keep in mind from a risk assessment standpoint. The fact that we see cancer in multiple generations, so your grandfather down to your dad, and sister, and even, or his sister, and even that aunt's son, that's showing cancer in 3 generations, which again makes it look like maybe there's something being passed from one generation to the next. So it's reasonable for us to be having this discussion, and I can understand why your doctor would have referred you over.
Is there somewhere that I can go or that my family can go to learn more about this process?
I'm going to write a letter about today's visit that'll talk about our discussion and kind of summarize things. And then I'll also make sure that your doctor's office gets a copy and you're welcome to share it with family members. And then if one of them would like to meet with a genetic counselor, we'd be happy to see them, or they can visit the National Society of Genetic Counselors website at www.nsgc.org. There's actually a link where they can find a genetic counselor in their area. So I'm going to have to take you back to high school biology for just a minute before we get into Lynch syndrome in more detail. Were you a big fan of that class?
Not really.
Not really. That's what I usually hear, so we'll try to make it painless. To review, our bodies are made up of millions of cells. All of them contain the exact same genetic information because that's our body's instructions. So it's essentially the instruction book that tells our bodies how to grow and develop and function. A gene is just a very specific piece of genetic information, and it has a specific job. So we have a whole group of genes that are good things, and they protect us from developing cancer. And they do that by telling our cells not to grow and divide when they shouldn't, and not to go places they shouldn't go, or they can repair errors in our cells. So sometimes people are born with one of those genes, those good genes, not working well. And when that happens, they're born basically with their defenses down from a cancer standpoint. And so they're born at an increased risk for cancer, and so we see cancers at earlier ages and more often. In the case of Lynch syndrome specifically, we usually see cancers like we've seen in your family: colon cancer, uterine cancer, other GI cancers, and ovarian cancer. So our goal, if we've diagnosed someone with that condition, is to say, if they're at a risk for cancer, how can we either detect that cancer earlier when it's easier to treat, or how can we reduce the risk for that cancer altogether? So we don't do genetic testing out of curiosity's sake. It's really because it can change someone's plan medically and really impact their quality of life and survival. So in your dad's case, it could be helpful for his doctors to know, because it might impact his current treatment plan if he hasn't had surgery yet. And it helps us know what he may be at increased risk for in the future if he's found to have this condition. So you could see how it's important to him. Any questions about that?
I don't think so. I think you explained it pretty well.
Okay, good. So if someone has one of these genetic conditions, there's a 50% chance they would pass it to a child. That also means there's a 50% chance that they wouldn't. So that's why it's really best to test your dad. Because if I did testing in you today and it was normal, does that mean he doesn't have it? Or that he just didn't pass it to you? So it doesn't really give us an explanation of what's going on in the family. So if we test your dad first and we are able to confirm this diagnosis in him, of course it's helpful for him medically, but also tells us what we can offer other family members testing for. So both you and your brother could be tested, and then ultimately his relatives too.
Okay.
Okay. Do you think he'd be interested in something like that?
I think so.
Okay. Well, then we'd be happy to see him and go over it in more detail. You can come back with him if you want, but you'd have to listen to all this all over again. Can I answer any other questions for you today?
Actually, we're really concerned about cost. Is genetic testing covered by insurance?
Genetic testing typically is covered by insurance, especially if someone has a suspicious medical and family history. And the nice thing is most people will use labs that will actually check with the insurance company first to verify coverage so there's no surprise out-of-pocket cost for family members.
Okay.
Any other questions I can address?
I think that's it.
Okay, well, it was really a pleasure meeting you. I think we have a very good plan.
Thank you.
Absolutely. Only 5 to 10% of cancers are due to an underlying hereditary condition that's being passed from one generation to the next and significantly increasing someone's risk for cancer. Genetic counseling can be helpful because genetic counselors will review someone's medical and family histories to determine whether or not genetic testing might be appropriate. They'll look for red flags like cancers diagnosed at earlier ages, such as breast cancer or colon cancer diagnosed before the age of 50. They'll see if there are multiple family members on the same side of the family and in multiple generations that either have the same type of cancer or cancers that we know can be related. We also know that rare types of tumors or even someone's ethnic background can play a role in whether or not a cancer is more or less likely to be due to an underlying genetic condition. A physician or a patient can locate a genetic counselor by visiting the National Society of Genetic Counselors website at www.nsgc.org.